You have the same screen I do.
Yep.
So we're on
Yep.
now.
I
Mr.
see
Wes
it.
Wright. It's always good to see my buddy Wes Wright and talk to you. It's been a while. How you
It
been?
has been a while, David. It's been good. It's been a while. Not that we've been in the same location, man. We've had things lined up for hymns and a couple of other things, and look what happened.
I know. Don't you miss your fine dining? Wine and dine with Wes?
It's one of those careful what you ask for kind of things. Like 80% of my time is spent out visiting CIOs, CTOs, CISOs, and going to conferences and stuff like you were doing. And there for a bit, I was going, man, I'm on the road way too much. And I would I would have liked to seen a travel taper rather than a cold turkey kind of thing, because I'm kind of missing the travel, the airplanes, the like you said, fine dining.
Missing the first class flights too, I'm sure. No kidding.
Hey, if you stick with the same airline long enough, you get upgraded about every time. So yeah, about this time of year, I would have been getting those free upgrades, but generally we fly economy anyhow.
Yeah. No, so what's going on? I mean, obviously the healthcare vertical has flipped its head upside down last few weeks. Some areas have accelerated. I think things that you and I have personally been talking about for 5 to 6 years, even longer, regarding making virtual desktop a standard, scaling out massively. The workforce, the telemedicine, I think that's been going on for at least 8 to 7 years, or 8 to 10 years easily. What else are you seeing in the marketplace? You're talking to a lot of your clients, potential clients. What are they thinking about in addition to COVID?
Yeah, well, that's pretty much nothing, David. To answer that, to give a short answer to that one, that's and rightfully so. That's what's on everybody's mind right now. There initially when things first kicked off, a lot of folks were spending time building new bed structures out. Turn this conference center into a 1,000-bed facility, and so that sounds easy to the uninitiated, but you and I know, well, yeah, it's easy to put the physical beds in there, but then you got to put the connectivity there, and then you got to put the compute devices there, and then over on the software side, you got to build in new locations and new beds in your EHR, your logical bed. So most everybody was heads down trying to do that, and then caught a little breather, and not to mention the tents, the drive-through COVID testing tents and that kind of stuff. And they got that done, caught a little breather, and funny, it's one of those doesn't rain but it pours kind of thing. So they're doing all that, building all that stuff out, and then they go, okay, now we want everybody to work from home. So then they had to start building that infrastructure out. And this is where the VDI, if you had it in place, this is where you're patting yourself on the back, because you go, okay, well, all I got to do is scale up my VDI infrastructure and throw on some more remote access licenses, which, by the way, Imprivata is handing out free through the COVID crisis. Right now, I think it's through the end of July, but I bet it'll get extended, so that folks that they never anticipated would work from home can work from home in a secure fashion. So they got that, and if you didn't have a VDI structure and you're still VPN and that kind of thing, man, you were ordering as many laptops as you could from. I think healthcare, well, not just healthcare, but everybody was doing this. I bet Dell and Acer and Lenovo, I bet we just pulled every laptop that they had in stock out of stock, and then getting those out and deploying them and making sure they're secure. So it's been I'll often say when I'm out talking to folks, healthcare IT has 10 pounds of work, but they only have a 5-pound bag to put it in. Now healthcare IT's got 20 pounds of work, but they still only have that 5-pound bag. And I just see folks starting to pop their heads up and get a breather in just within the last probably 3-4 days to a week. we see some folks coming up for a breather. At least that's what I'm seeing. What are you seeing out there, David?
I think you touched on a few different areas that was key. Logistics, right? How do you
Yeah.
procure thousands of devices at once? It's easy for one facility to do it, but what every facility in the world is doing that.
Mm-hmm.
So, like you said, lots of organizations couldn't fulfill. So people were calling in favors just to be able to get the thousands of workstations, iPads. And even right now, I mean, if you try to go buy a laptop webcam, that thing is sold out.
Oh yeah,
Right?
sold out.
Back order. Can you believe it? It's sold out. Webcam.
I tried to get one. You know, I'm working from home, and my friend that I'm staying with is working from home too, and she didn't have a webcam, and I went, I just get one from Amazon. Yeah,
Yeah.
June 1st, you'll get one from Amazon. Yeah, it's amazing.
Yeah, so all the devices are getting sold out. That's related to remote workforce. I would say.
Well,
even,
also, I think it's related to that facility build out. You know, when you put like in the Nightingale over in the UK, they put 4,000 beds in that that conference center, and the Javits for us. Well, they're going to have a computing device for at least every other bed. And those guys bought everything off. You know, I know some facilities have bought, 400 or 500 additional wows. So everybody, and then, where's the stuff come from? Mostly China. So, they shut down that manufacturing. So, wow, we had a big pig in the boa constrictor right there,
Yeah, so that's challenge number one. Number two, obviously the scale now. So the heroes are the ones that have been working on the virtual desktop environment. Some of our friends, our close friends within our network, they have been able to scale out. And even talking to a world-class recruiter, one of the things that she said was, at the end of this crisis, once we get past it, lots of organizations and senior executives would be able to determine whether they have the right person in their organization based on the fact that whether they were prepared, were they able to scale that quickly, did they have the proper innovations or chops to put together innovative solutions. So you will also see a big change in addition to what's going on the leadership side for executives, just because of what we're facing. Now, a lot of issues may be out of hand, out of the control in terms of whether you have the right budget or resource to help you deploy and scale effectively. But the ones that you will be able to tell who are the heroes and who are the not so glorified person.
Who are the heroes and who are the heels?
Yeah, better way to put that.
Yeah. Well, and some folks too, they've been pushing the button, trying to push the button for VDI, trying to push the button for some of this stuff, and they've been given the timeout. No, we don't have any budget for this, and now it's not very nice, and our moms and dads never told us to never do this, but there's a big I told you so opportunity there too, and I bet those VDI projects and stuff that weren't getting funded before are getting funded. Speaking of VDI though, the Microsoft Windows Virtual Desktop, I read somewhere that they increased 3 times over the last COVID period, and that is a pretty simple, easy way to get Windows Virtual Desktop to a client. But they only released that GA in November, I think. So healthcare, we're still a little bit hesitant to jump on new technology. So not a lot of folks in healthcare have taken advantage of the Windows Virtual Desktop, but I can really see that thing taking off here. Well, it has already taken off, frankly, but I can see it going a lot quicker in healthcare here after this crisis.
Yeah, definitely. That would be a definite trend. Hopefully, I mean, there's still a lot of organizations on Windows 7 too. So unfortunately, we still have a lot of those legacies, and going from 7 to the latest version and testing all these enterprise apps, making sure they work, that's also a monstrous task, but it has to be done. But the other part that we're seeing, I think you touched base upon, is where is the spend going to, right? Lots of organizations they're going through cost cutting right now. No matter who you are, capital projects have stops. People are
Yep.
looking at ways to scale a lot more effectively while controlling the cost. And people are taking salary cuts just to be able to stay afloat. So definitely budget cut is going to happen. And one of the largest departments and budget holders in the hospital is usually IT. So I do foresee a decrease in budget. One of our good friends, Zafar, he's predicting 7 to 10% cuts easily across the board in terms of where he is at. So I think that's a pretty good estimate, between at least 4 to 13% of a budget cut from IT. So how does that impact you guys in terms of your space? Obviously, everyone's going to get impacted.
Yeah, it's true, and we're seeing that impact. The big projects, the big there still are, believe it or not, a lot of folks that don't have Imprivata One sign deployed out there. That for them it might be a $1 million project or something. That isn't coming through anymore. I mean, people have. I think HCA today just announced a $400 million negative in the quarter, and they're going to recast guidance and stuff. And with that kind of stuff happening, they're not going to spend $1 million on one sign. So what we're seeing is expansion, and in some cases where the technology does make it a lot easier and a lot more efficient for providers to see patients, and in a near touchless kind of way, at least from a hands-on kind of way, they can get into their computers using the badge tap. So we see that happening, and we see an expansion of current licenses, especially our remote access licenses. We see a lot of people have taken advantage of the free offer that we have. And I think you're aware, but we just recently made a purchase of an iPad management, MDM for lack of a better term, called Ground Control. And we're seeing a big takeoff on that because of the virtual healthcare capability that the iPads can bring into the fight, from both give the iPad to the patient because the patient's quarantined, nobody in the family can come see him, so they're using the iPad to do Zoom or something like that, watch their own personal Netflix, and then when that patient's discharged, hopefully discharged, they take that iPad and plug it back into Ground Control, and Ground Control can wipe and restore it, in a matter of minutes rather than hitting next through a whole bunch of stuff. So we're seeing a use in that, and then because of PPE, the use of PPE, we're seeing the patient there with their iPad, and we're going, look, you've got an iPad. Why don't we just do, I'm outside in the hall, let's say, and why don't we, instead of me going in and burning a set of PPE, why don't we just do a video consult, and I as the provider can talk to you, see how you're doing, and make an assessment that way. And then I'm close enough to where if I think something's going bad, then we can burn the PPE. So we're seeing that, of course, take off. Anything to do with virtual health nowadays is really gaining some traction, as you might imagine. But the rest of our product suite, it's on a tread water and see what the stimulus does from a revenue replacement perspective, because as you know, everybody pretty much stopped their elective procedures and such. So I think that's when we might see some dollars free up, is when we see what effect the stimulus dollars have on revenue replacement for these facilities. What are you hearing about that from the stimulus perspective?
So a few states have started to open up electives. I think Texas, I think there's a few, I just can't remember which ones, but they're starting to opening up with certain protective measures. So that should definitely help. There are certain organizations, I even posted on Twitter the other day, that have went on and still perform elective surgeries, regardless of what has the sort of the pressure been from the government in terms of shutting down. Just because if they didn't perform these elective cases, the hospital would not even be standing. So I think things are starting to slowly get back up in terms of elective cases. Looking forward to talking to Aaron, who is the CEO of Ground Control, in the upcoming week to learn more about that product. I do have a lot of questions as well, just because I've utilized iOS in an enterprise environment before, and I've seen lots of great things in terms of managing devices, especially during time of crisis. So I think anything, like you said, anything related to telemedicine will be getting a lot of traction, just because there's stimulus funds for it right now, $200 million that's designated for anything related to telemedicine. Now, it doesn't have to just be a telemedicine specific enterprise software, but anything related to it. So for example, like just say you need to deploy and scale out your network in the rural areas. So you need to figure out how to get telecom service. You need to figure out broadband. You need to figure out how to deploy your network, whether you want to utilize SD-WAN to scale out. All those features can be part of that stimulus, as long as you put together the proper information for the grant. So I would say telemedicine is very general in terms of requirements. It doesn't have to be specifically a telemedicine platform or app, just anything related to it. So I definitely encourage lots of organizations. A few of our close peers in the CIO community have already put in their applications. So hopefully they'll get something and get the award so that they can scale out the practice. But I do agree, 2020 is unfortunately kind of dead, unless you have any offering related to scaling out remote workforce. Security is always going to be hot, and then anything related to telemedicine. Lots of organizations have put on hold healthcare CRM projects enterprise-wide, even ERP. Coming into this year before the pandemic, ERP was a hot topic across healthcare. Every organization was looking to make some sort of back office transformation, and every organization has to transition to some sort of next generation cloud ERP. Now that is going to be on pause. So 2021 at best, I hope. But that's where I'm seeing the market in terms of expenditure.
Yeah, I mean, we saw that identity and access management is also a big, was really starting to gain some traction. And we have I think, of course, I should, probably the best product, our IDG product for identity and access management. And we were really starting to gain some traction there. And again, those big projects from a couple of different perspectives, not just a financial perspective, but those IT folks and that would have been helping us set that up and do the work for that. They're busy doing that logistics, doing the deployment, making sure that their networks stay up for both the virtual health and for the remote workers. And it's I'm really hoping we see a V rather than a U in this recovery. You mentioned something though earlier, that security stuff. I've posted a couple things about this during. A lot of folks, you'll have a tendency to go, well, hey, this is emergent. Let's just get this stuff out here. I need to get this stuff out here so people can work remote. Boy, I think you've posted some stuff on it, and I've seen Drex post some stuff on it. The bad guys are certainly not letting a good crisis go to waste. Right. For sure, they are pounding healthcare probably worse than they ever have before. So this is really not the time to let your security pants down, because bad things might happen to you.
Yeah, definitely. The biggest threat right now on the security landscape is the phishing attack, the ransomwares. I mean, those two have just picked up dramatically, especially with the amount of devices that are being deployed remotely. But also, there are a lot of devices that people may not even be aware of in IT that are deployed, that are being used right now as part of the infrastructure. So, people are doing whatever it takes to work remotely. At the same time, we need to also be cautious, just because from a security aspect, one line I like to use is security is not convenience. Sometimes it sucks. I mean, personally, when multi-factor first came out, I really hated using it. I hated to go through that extra step, but I also recognize how important it is, and essentially it's starting to become a norm. Just like telemedicine, I foresee it to become the norm. It's not going to go away. Reimbursement model have been put in place right now for telemedicine visits. I'm optimistic, and I'm hopeful that will be the model of the future, that we don't go away and revert back to where it kind of may not make sense to provide telemedicine visit from a financial standpoint. Yes, I get it. Maybe a loss leader, maybe something to be utilized for population health management, value-based care. But at the same time, the healthcare system in the U.S. is still primarily fee-for-service. I don't care what anyone says; it's still primarily fee-for-service. So without getting reimbursed appropriately, I just don't see the financial model sticking. So I'm optimistic it'll be here. Last question for you. So we talked a lot about free software. Yeah, what does that really look like? People will have access to it for a few months, but
yeah,
what are you guys expecting past that stage?
Yeah, I think that's pretty much what it is. Right now, all of our free software and all of our stuff for current customers and some stuff I think for ground control, even new customers, it gives you, right now it's here free, use as many licenses as you want through July 31st. Again, though, like I say, I can probably see that expanding past July 31st, but then, at that time, if you were only using the software to get through COVID and you're through COVID, hey, that's great. I'm glad Imprivata could help you out. Don't need to do anything else. Just stop using it. But if you found some value outside of just COVID and you want to continue to use the software, then, talk to us and we'll just go through the regular procurement process, that kind of thing. It's not, we're not trying to get any hooks in. I mean, that's why I came to Imprivata. Imprivata is a good integrity-filled healthcare company. I think most everybody you ask within healthcare recognizes Imprivata as that. We've got a net promoter score of 56 when, Apple's got a 22 and Microsoft's got a 23. So people know that they can trust us. And when we say, here, use our licenses to get through this crisis, we're not looking really for anything on the back end. We just want to be a strategic vendor partner, David.
Yeah, that's awesome. Well, there you have it. Wes, great. Always great catching up with you. We'll
Same here, David. Yeah, right, you betcha, man.
All right, take care.
Wash your hands.
Put on the mask, buddy. Put on the mask.
There you go.
Take care.
Okay, see ya.